The advent of the internet has revolutionised communication and has put vast amounts of information at our fingertips at the press of a key. In seconds, we can glean any data we're looking for. And patients are increasingly using internet searches to learn more about their condition, understand the drugs they're on, and use chat rooms to support and encourage each other. But how do they know the information they're reading is accurate? It's not easy. This is Euphoria News, broadcasting from London. Hello, I'm Dr. David Bull and welcome to Euphoria News. The internet has revolutionised the computer and communications world like nothing before, and daily life without it is unthinkable. Any question, no matter how important or trivial, can be answered by a quick internet search. And as medicine becomes more individualised and complex, and access to physicians, primary care and hospital settings becomes more difficult in many countries, patients are increasingly turning to the internet to supplement their knowledge. But how accurate is the information they access, and what does it mean for their care? Well, a new, unique study carried out under the supervision of Howraman Meteran, published in the Annals of Allergy, Asthma Immunology Journal, looked at allergic rhinitis. It found that the videos available online for patients were at best useful and at worst useless or misleading. Well, to tell us more are Professor Vibeke Backer, Pulmonologist at the ENT Department at Rigs-hosptalet in Copenhagen. She's also a Euphoria asthma expert panel member. And the man who co-wrote the paper, Dr Howraman Meteran from the Department of Respiratory Medicine at Copenhagen University Hospital in Copenhagen in Denmark. Very good to see both of you. Thank you very much indeed for joining me. Now, I've got the study here. It looks at allergic rhinitis, which is a very common condition affecting about a quarter of the adult population worldwide. If I may start with you, Howraman, tell us about the study and what it actually revealed.
Yeah, thank you so much for giving me the opportunity. Yeah, so the study in brief, it revealed that YouTube is indeed a very popular search engine, not for only learning how to switch a lamp in our kitchen, but also when our patients are indeed very eager to obtain and gain more information about their chronic disease, such as allergic rhinitis. So we saw that it is indeed very popular in terms of views, in terms of comments and likes and dislikes. So the patients out there they are taking a position regarding the videos available on YouTube. And further, the more interesting part is, are patients actually learning something useful watching these videos? And surprise, surprise, there are some videos out there that we really should be aware of, because they are available for our patients and our patients actually watch them. So the good news is there are useful videos out there, but it's a jungle, and the misleading videos are quite popular, and actually the most popular videos. And yeah, so that's in brief what we found in the study.
So I really like that comment. It's a jungle out there. From what I gather from this paper, that something like 43% of the videos were useful, 36% were misleading, and 21% weren't useful at all. So as you rightly say, it's really difficult to know what you're looking for.
It is indeed. And I mean, one thing is, I had two medical students, the first authors of the paper and myself, spent a lot of many hours discussing. And obviously, although I know something about allergic rhinitis, I still have to go back to the literature in order to really be sure whether we should classify it as useful, misleading, or neither. And the real challenge here is, you could have a video that looks very professional, looks very nice, and the first 3 or 4 minutes they're just saying something really not dangerous. They're just saying learning the patients about anatomy and physiology, but then you will still have some messages that is indeed misleading. So when the first part of the video seems quite good, it's quite useful, but then there will be some information included in the video that indeed could be classified as misleading. So it could be a jungle even for a health professional. Then imagine what it would be like for a patient who doesn't necessarily has the same health background as we do.
So perhaps I could bring in Professor Backer here. I mean, clearly this is right. It's a total minefield out there, isn't it? How can patients distinguish between what is trustworthy and what is unreliable and what is online and clearly not worth the videos that you're watching?
It's interesting because if we just stay one step back and think about where we are using the YouTubes in our daily life, we normally would do that if we are going to do something we have never done before, like turn around the screen so it's upside down, for example. You can go in and have it on the YouTube and there get a feeling of how you do it, and then you try it off and you can see you turn the screen upside down. It's more difficult with YouTube videos of diseases where you don't know whether the ones who have made the disease, the YouTube on this disease, is knowledgeable in the area. It could also be it's different from what you are used to do in your country, like the diagnosis or the treatment or both. So I think it's right, Howraman. It's a jungle out there, and I'm not sure what we can do about it, because the young ones, they will use the YouTubes to get knowledge.
And just, Professor Backer, just in terms of what people were looking for, what sort of information were actually patients looking for? Just general kind of information about their disease?
Yeah, both. They looked at how they could, how the diagnosis was diagnosed, whether they could have other symptoms, which was not included, or the symptoms they had was pretty much what is included in the YouTube, and following that, what can I do about it?
And Dr. Meteran, just in terms of the videos that are available, when you were looking at this, what percentage of those videos were uploaded by HCPs and what percentage were uploaded by television shows, and what sort of engagement did you see for each of those?
Yeah, so that's a very good point, because I would say YouTube is a platform, and that is the original idea of this platform, is it should be open. It is unregulated. For the first time, we actually saw that YouTube regulated the content of videos was during the pandemic, because here, like many other aspects in healthcare, the pandemic showed us things we thought were wasn't possible before the pandemic. All of a sudden, we saw it actually is possible. One thing was that YouTube actually started to rule out or actually take out the possibility to upload YouTube videos regarding the COVID, because there was a high proportion of misleading videos. So they actually acknowledge that there is indeed a high number of misleading videos. So the next obvious thing would, of course, be looking at all the diseases, but that would take ages to do so. So to answer your question, yeah. So we divided based on the previous literature on several categories, so we could actually we have the possibility to analyze the source of uploader, so to speak. So was it specialist? Was it a medical doctor, companies, etc.? And if we pulled the group of medical doctors and specialists, so that would be an ENT, that would be an allergologist, then it was actually less than 20%. So roughly 15% were medical doctors, and then you had companies as a sole group. It was 9%, and then you had TV shows and a YouTube channel, so a dedicated YouTube channel. It was actually 40% of the videos came from TV shows. So one might think that since that the subject allergic rhinitis is a healthcare professional, that you would all imagine sources that actually has a profound knowledge about this subject, but it was, as I said, around 17% that actually came from healthcare medical doctors. So one might think that a viewer, that a patient, let's say it could be a carpenter without any background information about allergic rhinitis, would prioritize a video from a healthcare professional, but our analysis actually showed that's not the case. So the real challenge here is that if you, as a layperson or any person without any search history, go to YouTube and write allergic rhinitis, then it would be, so if the search engine and the algorithms behind these search engines do not know you with a profile, knowing that you were really interested in allergic rhinitis, then it would be the built-in algorithms, so they will actually show you the videos with the most views. And especially, so if you have a video that all of a sudden is trending in terms of views, likes, dislikes, because it shows that there's something, it's engaging the viewer. So there is a high risk of a layman would be presented a misleading video from a company or a TV show, rather than a very useful, nicely, professionally made video from a ENT doctor.
So that's absolutely fascinating. So Professor Backer, I mean, clearly we're talking about allergic rhinitis here, but clearly I would assume similar data, you get the same sort of results if you look up things like asthma, if you look up sinus disease. It's just impossible to know, given the algorithms and given what you're presented with, what is actually true.
I believe so. And the allergic rhinitis is actually a pretty easy diagnosis to put forward, because you have the symptoms. And they could be seasonal. They could also be all year round. But if they're seasonal and you have the grass pollen season and you have the symptoms in the grass pollen season, it's very obvious that it probably is hay fever, for example. Whereas asthma, when you're short of breath or chest tightness, it could be different things like low fitness, that you have anemia, you are pregnant, you are having closure of your vocal cords, things like that. And that's absolutely not asthma. But you have exercise-induced symptoms.
So, Dr. Meteran, where do we go from here? I mean, it's a really fascinating study, and obviously the findings, I didn't expect to see what you found. So just in terms of where we go from here, how on earth do we educate patients? How do they know where to turn? How do they know where to look for veracity?
Well, firstly, I think the first step would be we have to acknowledge that patients are searching for information online, and we should meet them in this search, and we should just talk about it openly. So that's the step one. Acknowledge that they do so, and we should just talk openly instead of accusing, or instead of tell them not to do so, because they will do it. And I think it's a natural behavior in human being. We are eager and we are interested in our diseases. Luckily, I would say. The next thing would be, the easy part would be actually to identify a number of relevant and useful videos on a given disease. It could be allergic rhinitis, asthma, sinusitis, etc. Having like 5 or 6 links, so you could actually provide it to the patient. Say if the information in the clinic here wasn't enough, or when you come home and you still have a couple of questions and you want to hear some useful information again, I will actually recommend you to see this YouTube video. I think that's the way to open up that it exists, and you actually help the patient to find a way in this big jungle. That would be the easiest steps to take right now. But of course, YouTube is just one of these online platforms. The next thing is, all the other platforms that are really, really popular. YouTube is, I would say, it's for open for everybody. Vibeke said that is especially the young ones. I think everybody is on YouTube, but a social media app such as TikTok, which is highly, highly popular. We've seen that the politicians in Denmark, we just have an election, those who are really popular there, they actually got a really great election. So I could imagine that the young ones, the children and the young ones, they are more exposed to sources such as TikTok. And then we have lots of different Facebook groups. And that's a study we're actually conducting right now. We are looking at what kind of advices are the patients giving to each other on Facebook groups, because these exist indeed. And has another aspect, because here you have a patients meeting and share experiences rather than just it's a one-way as it is on YouTube. So there's a lot of, I think it's a very interesting area of research. It's a very low practical, but I think it would have high impact on on a public health level, because the reach out has great potential rather than just sitting in your clinic having one patient at the time.
I mean, it's a really good point, isn't it, Professor Backer? The fact is that we know different age groups go to different social media platforms. For example, older people tend to go to Facebook, younger people tend to go to TikTok. Isn't the answer to this that actually we should have Euphoria approved messages, or saying these particular videos are approved by Euphoria? It's the stamp of authority, the stamp of approval.
There's two answers to that one. Because I think there's two ways we can go. We could make a YouTube with a title which is in the beginning of the letters, so it will be in the top, so most people will use them. The other thing is we could have a thing like organic food, which is labeled as organic or without lactose or whatever. That could be something, yeah.
Well, exactly right. I mean, clearly it's food for thought. Thank you very much indeed to both of you, to Dr. Meteran and to Professor Backer. So clearly turning to the internet may not be the panacea that many patients think it is. There is a definite gap here in terms of how to educate patients and provide important advice. And that gap can be filled by the excellent work of Euphoria. Well, to tell us more is Mrs. Elizabeth Van Steen, who is Scientific Communications and Advocacy Manager at Euphoria. Very good to see you, Elizabeth. Well, clearly the internet isn't the only answer. So tell me, how does Euphoria try and fill the gap in education for patients suffering from respiratory allergies?
Thank you, David. And that's certainly what we're seeing. So while it's wonderful that patients are becoming more empowered to play an active role in their healthcare plan, it's important for both patients and providers to understand that the internet is a very powerful tool, and the information that's available on disease management, whether for allergic rhinitis or any other disease for that matter, is not always going to be helpful or accurate. So the fact that anyone can create content and provide misleading or unfounded medical advice is something that we're always faced with. So at Euphoria, we aim to listen to real concerns of real patients so that we can provide them with evidence-based and expert-led resources that will help them to either seek appropriate care or to improve the effectiveness of the treatment that they're already undergoing. So with allergic rhinitis, for example, we have detailed videos available for patients on the Euphoria website and YouTube channel about how to correctly use a nasal spray and how to properly rinse the nose with saline. So I think many patients who have used nasal sprays for many years may be surprised to learn that they may have been using them incorrectly all this time. And this can potentially be a source of improvement in the management of their symptoms.
That's absolutely fascinating, and clearly you're doing all the right things. But what's the outreach like? And tell me, what's the awareness of Euphoria like amongst patients?
So I think Euphoria, we engage with patients in a few different ways. And the awareness of Euphoria among patients is improving each year. So we have a patient advisory board, which was launched in 2017. And this was really, and the aim of the patient advisory board was really to create a network for patients to share the physical, the emotional, and even the financial impact of their disease and its effect on their quality of life, because we all define that in different ways. So the Euphoria Patient Advisory Board, we meet virtually around 4 times each year, and it's an opportunity for patients to really discuss their unmet needs and their suggestions for improvements in care, and to suggest how to raise awareness at the political level as well. So these meetings have gathered some incredible insights that have really delivered real impact to the patient community. So we've had the launch of the Global CRS with MP Awareness Day, in which will continue in 2nd edition this April. And we've also had 2 patient-led publications in the last year, which have suggestions for patients living with type 2 inflammation. And these are actively incorporated into Euphoria educational initiatives for healthcare providers. Additionally, patients are also regularly represented here in Euphoria News, as well as the Innovation Board debates alongside our network of medical experts.
So going forward, tell me, what are Euphoria's ambitions? I mean, clearly this is about improving knowledge, empowering patients to achieve better disease control.
Indeed. So we have some exciting initiatives on our agenda for 2023, and we're really looking forward to expanding our patient portfolio to include even more patient education materials, not only for patients themselves, but also for caregivers. And this includes the expansion of our patient advisory board. So any patients with allergic rhinitis, or hay fever, as many people would say, asthma, chronic rhinosinusitis with or without nasal polyps, or any combination of those conditions are encouraged to participate. And we'll include a link below for anyone interested in joining to see how they can get in touch with us to get involved.
Well, fantastic to talk to you. Thank you very much indeed, Mrs. Elizabeth Van Steen.
Thank you, David.
So there you have it. Always trust your sources and contact professional bodies for accurate advice. Well, that's it for this Euphoria News Show. Many thanks to my guests, to Professor Vibeke Backer, Dr Howraman Meteran and Mrs. Elizabeth Van Steen. Now, you can find more information about Euphoria and register for the Euphoria educational events on the euphoria.eu website, where you can also sign up to receive the latest news via email. And don't forget to follow us on social media on YouTube, Twitter, LinkedIn, Instagram and Facebook. Our information is accurate. Until next time, goodbye.